Hello.
Hi, Sarah. How are you?
Good. Can you hear me okay?
Yes, I can.
Okay. Well, I'm happy you agreed to talk to me. I'm really
Yeah,
excited for this interview.
no problem. So, what are you majoring in?
I'm still not sure yet. This is my first semester,
Okay.
and I'm just trying to figure it out. But I chose to do ASAP actually as like the resource I wanted to research because I have like a part of me has been thinking about like getting into that field and like Um, I'm not completely sure, but part of me is really interested in how all of that works.
Good. Perfect.
Okay, so maybe you would just like to start by introducing yourself?
Sure. My name is Laura Richter, and I am a licensed professional clinical counselor, and I work for ASAP, and I'm actually the clinical manager
Okay.
uh, for ASAP. And let me see, I've been a counselor probably for about 16 years. Initially started out at Turquoise Lodge, which is an inpatient substance abuse detox rehab hospital. And then I switched over to UNMH about a year later. And for 6 years, I worked with the severely mentally ill in the community. And then I kind of switched over to substance abuse counseling because that's kind of like my passion.
Hmm.
I've been probably doing that for probably about 10 years now.
Oh, wow. Okay, so maybe for like the people who are watching, I think it would be a good idea to like introduce this resource. Tell me a little bit about what it is, what its purpose is.
Sure. So ASAP is a alcohol substance abuse program. And the big component of it is that we have what's called a methadone clinic.
Mhm.
So it's opiate replacement therapy. And we provide methadone for clients that are have been or are kind of addicted to heroin or any other kind of opiates. And often we get pregnant women as well that come that are addicted to heroin or other kind of opiates. So we start them on a opiate replacement therapy. We also have something that's called a Suboxone as well that we provide to our clients. So, but not only that, we also have counseling and psychiatry as well as like primary care for clients that have maybe methamphetamine use disorder or alcohol use disorder or cocaine,
Mhm.
any kind of substance, so even marijuana.
Mhm. Okay, good. Yeah, I was gonna ask about methadone. That's, I believe, what's known as like a preventative medicine.
Preventative, well, I would say preventative because it's really you give it to people. Yeah, I mean, people take it because they want to kind of get off of something,
Mhm.
some opiates. So it's really just a replacement. And I don't like to use the word replacement either because people think, well, you're just replacing one addiction for another, but
Mhm.
that's not the case really, because there's no like high associated to it, I guess, compared to maybe some other substances.
Yeah.
So what it allows them to do is not kind of have to go through that withdrawal, that they often get with many other substances. And it really just kind of helps them, allows them to really focus on their recovery a little bit.
Mhm. Yeah, so you would say that it would be effective in treating substance abuse.
Yes, correct. But only for opiate use disorder. That's it.
Right.
Mhm.
Okay. All right, could you tell me a little bit about like the location of ASAP, maybe like its physical environment?
Sure. So we are located by the airport. Actually, it's 2600 Yale Boulevard. And yeah, we're probably like half a mile from the airport. And yeah, it's just that we have a really kind of cool clinic in the sense of that we have, like I said, we have primary care as well as psychiatry
Mhm.
as part of it. So you'll just see a lot of people just coming in and out, dosing for methadone as well as receiving other kind of services. So So we're in
Wow,
a
okay.
kind of a two-story building. So yeah.
Yeah, and maybe we could talk more about its background, like when and why it was created, the purpose behind this organization.
Sure. Historically, I've only worked there for 10 years, so I can't say for certain how it started. But I think initially it started out as a more of kind of a research um, for addictions, and I think and then it started slowly gravitating towards treatment. Is my understanding.
Mhm,
My understanding the office itself has moved around quite a bit to several different buildings, and now we have our home right now. Um, and I guess it just kind of, well, when I started working there, it was just strictly a methadone clinic, and that was, probably about 10 years ago.
mhm.
Uh, yeah, so historically, I'm not quite sure how it started, but all I know is that it initially started out for more like research. There was big
Okay. And
research,
then
and
it's
part of
changed.
UNM. Yeah, it was part of UNM actually.
Okay. Okay, wow, that's really interesting.
Yeah.
Um, I am curious about how it's changed from a research clinic more so to focusing on treating people. Is that because maybe like the demand for what was needed in this area changed? Maybe like a problem was realized?
Yes, probably. Yes, I think so. Well, there's CASA right now, which is part of UNM.
Mhm,
They're actually very close to our office, but yeah, I don't know exactly when they're separated, but they just do strictly just research, and sometimes they will ask us to be part of it because they're looking for certain maybe clients that meet the criteria, so, like alcohol use disorder or sometimes opiate use disorder, and they want to have us try different kind of modalities, regarding counseling, like motivational interviewing, maybe CBT. So every now and then they'll ask us to see if we could find enough clients that might meet that criteria. So
okay,
sometimes we overlap. Yeah.
okay. And then for everybody watching, CBT is cognitive
Cognitive
behavioral
behavior.
therapy, right?
Yes.
Okay.
Great.
Yeah, which is how would you describe CBT?
Well, it's kind of, I look at it as cognitive behavioral therapy as really changing how you think about things, you know, and kind of like if I always thought that I'm a failure, something like that, right?
Mhm,
Because of my past history, just to be able to change that perspective on me, that I am not a failure, that I can, I may be a failure in one thing, but not everything, So it's
mhm.
really just changing your way of thinking a little bit.
Yeah, like
Yeah.
changing your thought process
Yeah.
behind.
Correct. Correct.
Yeah, I've always liked CBT. I
Yeah.
found it very helpful.
It's very helpful.
Yeah. And what would you say drives people like you who work at ASAP? What makes people, because you said you were passionate about it.
Yes. Well, I think um, I really, I really see change in person. Nobody becomes addicted to a substance because they want to be addicted.
Mhm,
They generally always start out maybe in a party setting using some sort of substance, and one thing leading to another, and so and it's difficult for them to get off of substances. So for me, I mean, I just when I see them really doing well, and they get their children back from CYFD, or they can get a job or go back to school. There's just a lot of success stories.
mhm.
Sometimes it's not successful, but there's a lot of success stories,
Yeah.
um, and it really combined with counseling and the opiate replacement therapy, as well as they need psychiatry or medical care. It really gives them a chance to kind of just kind of get back to what they consider normal, like everyone else, like you being able to go to school. So
Mhm. Yeah.
yeah.
Well, that's good to hear that ASAP has seen a lot of successes.
Yes.
Um, I did have a question about that, about like maybe what is like a story of a typical user. Obviously, we can't have any details because of
Yeah.
the.
Well, I don't know if there's a typical user. Um, huh. Well, I'm just kind of thinking of who mothers who come to our clinic and they're pregnant, they get on opiate replacement therapy. Um, their typical user might be, they start using at a very young age. I would say, 14, 15, and typically they start out with maybe opiate pills like, Vicodin, Percocet, something like that,
Mhm.
and it just becomes a very expensive habit. And they might start snorting heroin first, and then that doesn't work. They build a tolerance, so they started injecting heroin. And typically it seems like, I mean, we do have some young people, like teenagers, come to our clinic, but typically they're probably, I don't know, 20 or 21 when they first come in. They realize they have a serious problem.
Yeah, so you'd say there's no like typical clientele. It could be young or old or like.
Yes, yes, it could be a wide range of clients for sure.
Okay, that's really interesting. Because I know that there is kind of a stigma that follows people who
Yeah,
struggle with addiction around. And
absolutely.
that was
Yes.
another question of mine. If you had any opinion on that stigma and that stereotype of like the typical addict.
Do I have an opinion? I just totally disagree with anyone that looks negatively, I think, at substance users, because they're just no different than you and I. They're humans, and they just you know, kind of, like I said, nobody ever starts out saying, I want to become addicted to drugs,
Mhm.
and it just kind of happens to them. And I mean, they're just no different than us, and they just have,
Mhm.
it's no different like having diabetes or something, right? You don't get blamed for having type 2 diabetes. So
Mhm.
um, but so that's the way I look at it, as addiction as something like that, actually having a medical illness. And with help they can kind of get off of substances, or get stabilized. So
Yeah, I did participate in a few AODA programs, and I participated in like an adolescent program and then
uh-huh.
later an adult program. And I know I had a counselor there that I met who would say the same thing, that nobody chooses to get addicted to something. You just have to choose how you respond to it.
Exactly.
Hmm. Yeah, I think that's very important to know.
Mhm.
Um, and I was curious about how does this resource, structure itself with like the hierarchy, how it's kind of organized?
How is it organized? Well, we are a counselor driven program.
Hmm.
So, that's super kind of an important component for recovery for everyone. And like I said, we also have psychiatry as well. Like I work as part of what's called a dual clinic, and we have psychiatric residents, 30 residents that come through, and I happen to work with severely mentally ill with substance use disorders. So there's really no hierarchy, but we just have different components of our services. But just in a nutshell, it is really a counselor-driven program. And that's what we encourage all our clients to receive therapy, because it's not just we do relapse prevention and we do all that. But, a lot of our clients come in with serious trauma, as well as other mental illness. So, we just kind of treat all that, in the big picture of things. So,
Yeah. I did participate in a dual diagnosis program when I was younger.
okay.
Mhm. And I know it was dual diagnosis is a substance abuse problem combined with like a mental illness.
Yes,
And it's sort of focused on treating both of them at the same time, correct?
correct. Yeah, because we sometimes we don't know which one came first.
Mhm.
right?
Yeah.
Is it because you're depressed, or are you using drugs, or is it using substances and that's causing depression? So,
Yeah, and it's more effective than just say, like, trying to treat the substance abuse problem and then
correct,
the
correct.
underlying issue doesn't ever get any worse.
Yeah, because if you think of someone that just has depended on substances for many, many years, right? I mean, they're really learned to use that as a really as part of a coping skill, when they become depressed or anxious. So when you take that away from them, all that just kind of comes back.
Mhm,
And so that's where therapy becomes really important to kind of help them, get through the next part of their recovery. So.
mhm. Yeah. Well, that's really cool. I think it's definitely an effective way of helping people.
Mhm. Yeah.
I'm also curious about like what a typical day would be like on the job, a typical interaction with the client.
Yeah, so typical day, at least before I became a clinical manager, typical day for me would be I would have probably um, 3 or 4 scheduled clients a day. And then we do what's called a walk-in clinic as well. If there's any like crises where they haven't been seen in a while, we also take turns kind of doing walk-in clinic. And then of course we have meetings almost every single day that we attend. And as well as we have, throughout the year, we have multiple trainings as well, because we are really an evidence-based clinic. So everybody's trained in either like many things like trauma-based treatment or cognitive behavioral acceptance commitment therapy. There's different modalities that we all kind of just specialize in. Uh,
Hmm.
yeah, so
Yeah.
it's a busy day.
It's
Yeah,
sure it sounds busy. It sure
it's
does.
very busy. Yeah.
Um, and we talked about like there is no typical client. It's sort of it could be an issue affecting anybody.
Yes.
Um, I was also interested in different programs offered at ASAP because I did look on your guys' website and
Mhm.
I saw a few different programs offered. And I was curious if you could tell me a little bit about any of
Yeah.
them.
Tell me what you saw online. I'm just kind of curious.
Yeah, I saw information about an adult program. They definitely had information up there about methadone, which I had never heard of that name before. Um, I saw information about mainly just the adult program. I didn't see much about any others, which is why I was curious, but I'm
Yeah,
sure there are others.
that's our main program that we have, but we also have an adolescence program too.
Mhm,
And they're part of ASAP, but I don't oversee that program.
mhm,
But it's a very small clinic that really works with adolescents, typically 18 and under.
mhm,
And yeah, and they could have anything from marijuana use disorder to opiate use disorder.
mhm,
Um, and yeah, it's just and then we have psychiatry also attached with the adolescence program, as well as psychologists and counselors. So, and just for your interest, Sarah, I know you said you might be kind of interested in um, just kind of maybe looking into a counseling program or something like that. But we also have a really good internship program as well.
oh,
Uh,
wow.
and we have interns from the UNM counseling program, as well as a variety of social work programs that are in New Mexico. And typically they will do a year rotation, 2 semesters through our clinic. And many of them end up getting jobs at our clinic after.
Mhm.
So
Yeah, I'd definitely be interested in that. That sounds like a great opportunity. Um, I know that when I participated in both adolescent and adult programs. And I saw a major difference between the two programs. I saw in my experience that um, with the adolescent programs, it sort of tended to be a little bit of a competition between kids, like to see who could take the hardest drugs, like who could take the biggest risk and sort of like um, really make some scary decisions. And then I just didn't have a very good experience with that. I always felt like um, that wasn't the experience I wanted out of it. And then when I reached 18, I participated in some adult programs and I saw that it was just very different. It seemed like um, I was the youngest one there by far, and everyone was very open about the hardships that they had faced due to their struggles with addiction, and nobody ever wanted to think like, "Oh, I'm cooler or whatever because I got into this."
Yeah,
They
that's
seemed to
probably
think the
fair.
opposite.
Mhm. Yeah.
Yeah, would
Because
you
when they're adolescents, it's more like peer driven, I think,
Mhm.
than when you're an adult.
Yeah.
Yeah, there's less of that. Like, oh yeah, I'm using more drugs than you. I don't hear that in groups with adults. So, and
Mhm.
I've never really run a adolescent group. So,
Mhm.
yeah, thank you for that information.
Yeah, I mean,
Yeah,
I always thought that was just interesting to me.
yeah.
How effective would you say, in your opinion, is ASAP as an organization?
I I think it's pretty effective. I can't give you a percentage,
Mhm,
um, because everybody, I think, they everybody is on their own schedule when it comes to their recovery. You
mhm,
know, sometimes first time on methadone, they get it and they do great, and then sometimes it's a takes a couple of bouts of it,
yeah,
to kind of really realize, oh God, this is really helping me. And you got to realize, a lot of many clients, and not just at our clinic, come because they're being told they have to, either legally or maybe even their parents are making them come, or their spouse is making them come, right? Or their kids might be in CYFD custody, so a lot of it is just, sometimes they come with just external motivation,
mhm,
like, and then it just takes a while to become more internally motivated to say, oh God, this is great, this is actually really good for me, and not necessarily doing it because somebody else is telling them to do it. They're doing it
yeah,
because they really want to do it.
that makes sense. I've read a few books on addiction, and I know, I read one called Beautiful Boy by David Sheff.
Oh, I'm gonna have to. Beautiful boy.
Yeah,
Okay.
it was a really good one, I liked it, and it's basically the story of this father whose son is addicted to methamphetamine, and he's trying everything he can to help his son, trying to, like, figure out the science behind it and
Right.
just trying to help his son. And I think, one thing I really learned from that book is that you can't expect anybody else to get better because you want them to get better. It has to come from within themselves.
Exactly. As counselors, we can only provide them the tools
Mhm.
and information um, regarding recovery, and whether they use it or not, it's totally up to them.
Yeah. Is that something you find frustrating having to deal with?
Yeah, it is frustrating sometimes. Because often they're either pre-contemplative or contemplative when they come see us, and it just kind of takes a while, because it's not really me, it's their thing, right? So it's kind of hard to kind of get them over to more taking action or
Mhm.
preparing for treatment. If you call, we have what we call the stages of change,
Mhm.
and
Yeah, I
it's
remember that.
yeah, so it's kind of hard to kind of boost them into the next stage sometimes. And it just
Mhm.
takes a while. So,
Yeah.
and often they'll get stable on one substance, and then they'll start taking something else. And so it's just kind of like this vicious cycle, that they go through until they finally decide, no, this is it for me. So,
Yep.
yeah.
Yeah, and that's really interesting. I was also curious as to how the mission of ASAP has connected to larger issues in modern America, and how, especially in Albuquerque, I know there's more of a problem with drugs like methamphetamine than where I'm from. And I was curious as to how, like, the mission of this resource is impacted by, um, the state of everything going on around it.
I think it's impacted big time, for sure. Um, yeah, unfortunately, our focus is mainly on opiate replacement therapy, but
Mhm.
we are realizing that methamphetamine is really becoming almost, at least to me, a bigger issue in a way, because there's really no standard treatment for methamphetamine. And we have like the matrix model and all that, where they come to group and like IOPs and all that, but there's like hardly any medications to treat them.
Mhm.
But yeah, I mean, I think we're working on as a clinic really to expand some of those services for methamphetamine users, because it's just a really a high need population, because they have, methamphetamine um, users kind of have a lot more health effects, it seems like.
Mhm.
Not only do they have hep C and all that, but they also have like major dental problems, heart problems. It seems like they all have more, um, you know, mental illness may be caused by methamphetamine use disorder, like psychotic disorders. And they really, I think, my understanding is that they really, in a way, um, really utilize the emergency room services a lot, as well as the behavioral emergency room services. So, yeah, definitely there's a big need for it.
Yeah, so definitely is impacted by
Oh,
its
absolutely. Yeah.
yeah. Yeah, and I guess, we're reaching the end here. I'm running out of questions, but my last question would be, what would you say to anybody who is unsure about seeking treatment?
What would I say? I would just say give it a try. Give it a try. If they're contemplating, I would just say, hey, just give it a try. It's kind of
Mhm,
like a kid. I always say, kind of learning how to walk, and they'll stub their toes a couple times and they'll fall, and recovery is kind of like that.
mhm,
You may start, and you may say this isn't for me, and kind of go back to your old behavior. But if you try it enough times, eventually something's going to click.
mhm,
I mean, I see that all the time. It takes like 2 or 3 or 4 times to really, um, really kind of, like I said, become that switch that goes off in somebody's mind. They become really internally motivated to change.
mhm. Yeah, and I think that's great advice, you don't have to expect perfection right away, but
Yeah.
there's no harm in trying.
Yeah. And sometimes, we all are clinicians that we have. They're excellent clinicians, but sometimes it's, well, they don't click with me as being a therapist, so they
Mhm,
come back and they try someone else, and it's like, oh, this person, works really well with me. So, it's just really trial and error, and you just have to keep on trying, and
mhm,
eventually you'll have all those skills that you've learned. It's going to become much more easier, I think, to use them.
mhm.
So
Yeah. Well, thank you so
yeah.
much for
So,
talking.
so what is this for? I'm just kind of curious.
Yeah, I should have told you, I'm sorry. This is for my English class. We are meant to record an interview with somebody on, like a resource available to students on campus, and we're supposed to pick one that, interests us. So
Okay.
I picked ASAP, and, yeah, we just have to, write about that resource, write about everything we learn about it, and sorta create a website about, um, everything we start to understand.
Oh, okay. Cool. So it's just kind of like a practice website that
Mhm.
you're doing. Cool.
Yeah,
So,
I'm very excited. I think this was a great interview, and I learned a lot from you.
yeah, well, good. Yeah. So if you're ever go through the UNM has an excellent counseling program. That's where I graduated from. So if you're
Mhm.
ever interested.
Yeah, I am definitely looking into it.
So,
And thank you so
are
much.
you from Albuquerque?
I'm not. I am from Wisconsin. I just moved here for this semester.
Okay.
Um, yeah, it's definitely different here, but I like it.
Yeah, it's probably very warm and dry, right?
Yeah, it's definitely a lot warmer than what I'm used to.
Oh, good. Well, it was nice meeting you.
You too. Thank you so much.
Okay, take care.
You too.
Okay,
Okay, bye.
bye.